If an 8-year-old boy has cancer and the new law keeps insurance companies from rejecting him for coverage, is that a good thing or a bad thing?
Recognized.
Thank you, Mr. Chairman. In its face, in a vacuum, that would be a bad thing.
Mr. Chair.
Mr. Clemens, you're recognized for a question.
You say in a vacuum. Under what circumstances would that be acceptable for an insurance company to reject a child?
Recognized.
If the product that they had purchased that had been provided to them that wasn't available to them if that benefit was not covered under that, then that would be something that the individual family would have to account for and look for solutions for.
Mr. Clemens, you're recognized.
The closing of the donut hole for seniors, under what circumstances would that be a bad thing?
Mr. Brodeur.
Thank you very much. The donut hole exists out of the 2006 federal law, only shifts costs. And so the closing of the donut hole may be a good thing, but then at the same time, it reduces the ability for some people to get medication at an affordable rate. The alternative argument to that is that when you don't have medication at a market price value, there is no money left for investment in the future medication. So again, in a vacuum, it sounds great, but when you look at the entire industry, I think what this bill does, the costs of it are too great to accept the individual parts that might be okay.
Sure. Mr. Clemens, you're recognized.
Thank you, Mr. Chair. Because you're talking about the costs, I mean, what costs are acceptable to making sure that people get insured and what costs aren't acceptable to you?
Recognized?
I think that's up to the individual. If we had transparent pricing and a free market, the individual and their family could determine that.